Hello everyone, welcome to my page and you're welcome to Blissful Life. My name is Priska. Today we'll be talking about the pelvic inflammatory disease or the PID. Pelvic inflammatory disease is an infection which affects the female reproductive system, which includes the uterus, the ovaries, and the fallopian tubes. Most often, the sexually transmitted bacteria spread from the vagina up into the uterus, the fallopian tubes, and the ovaries, causing PID. Okay, so what are the causes? What actually causes, or what could cause pelvic inflammatory disease? A lot of bacteria can cause PID, but the gonorrhea and chlamydia bacteria are the most common types of causative factors that could bring about PID. And these infections, I mean the gonorrhea and the chlamydia, are sexually transmitted infections, all right? Also, there are things that could put you at a very high risk of having PID. This includes being sexually active when you're younger than 25 years old, having multiple sexual partners, being in a sexual relationship with someone who has more than one sexual partners as well. Again, when you have unprotected sex, when you have sex without condoms. Another thing can include having a history of PID. That is when you have reoccurrent sexually transmitted infection, especially gonorrhea and chlamydia. It could also put you at a very, very high risk of having pelvic inflammatory disease as well. How are you going to know that you've got pelvic inflammatory disease? One, there is pain. Although sometimes the symptoms are very difficult to detect. But then these are the symptoms. Pain. There is pain which could range from mild to severe in the lower abdomen or the pelvis. There is irregular periods or spotting. There could be unusual and heavy vaginal discharge, which can be yellow or greenish in color and which can have a very, very foul smell, which can smell so badly. Okay. There is pain during sex. There is pain while urinating. There is abnormal bleeding. There is abnormal vaginal bleeding during and after sex. Okay. There could be fever. The person might have a very high fever and vomiting as well. So when you notice all these unusual changes in your body, you should quickly seek medical attention. So when you go to the doctor to make a complaint, there are some tests that the doctor would ask you to do. There are some tests that you should carry out so that they would know whether you've got PID or not. The first is blood test. Your blood may be taken off to check what's going on with you. Also, there is you would be asked to do an ultrasound, a scan. All right, scan helps to visualize the reproductive organs since this infection attacks your reproductive system. So when you go for a scan, the scan will detect and know if actually you've got this pelvic inflammatory disease. Also, the doctor would also send you for sexually transmitted infection tests. All this is just to rule out and be sure if you've got PID or not. Now, for the treatment of this particular infection, for the treatment of PID, it's usually through antibiotics. The treatment is usually an antibiotics treatment, which could last for about 14 days. And then when you're on this treatment, you should stay absolutely away from sexual intercourse. Even if you want to have sex, you should use a condom. Why? Why is because this PID is sexually transmittable. So if when you're on treatment and you go ahead to have unprotected sex, there is a possibility that you're transmitting this infection from yourself to your partner, which can be really bad. Okay, it can be very, very bad. So when you get PID and you don't have a proper treatment, or you don't treat it very well, or you don't go to the doctor on time, these are the complications that could result from having a pelvic inflammatory disease. One is ectopic pregnancy. Why? When a woman is pregnant, or when the egg fertilizes, the egg travels through the fallopian tube into the uterus, where the baby will start growing. But then, when you have untreated pelvic inflammatory disease, it causes scar on the fallopian tubes, thereby preventing thereby preventing the fertilized egg to travel through the fallopian tube into the uterus. So what happens is, once the egg is fertilized, it cannot cross, or it cannot pass through the fallopian tube because of the scar, thereby causing the egg to start growing in the fallopian tube, causing ectopic pregnancy. The egg is not supposed to grow in the fallopian tube. It's supposed to go down into the uterus. But because of PID, the child starts growing in the fallopian tube, thereby causing ectopic pregnancy, which can be life-threatening. Then there could be infertility. Yes, if PID is left untreated and it's left to linger for a very, very long time, there could be infertility. Also, there could be chronic pelvic pain, which could last for months or years. Okay, so that is why it is advisable to seek medical attention as soon as you start noticing all these changes in your body. Now, what is the prevention? The prevention of PID is just to practice safe sex, use protection, limit your number of sexual partners to the barest minimum. Also, when you get new sexual partners, you try to know their sexual history. You try to know if they've had any sort of infection in the past or not. And also try to go for regular checking. Some people go for 3 monthly check. After 3 months, they go check themselves, do a holistic test on themselves, and if any infection is detected, they start treating it on time. Okay. And again, when you have PID, you have to be truthful to your partner, because if you keep it away from them, you are ending up giving them the infection. And if you treat it yourself and they are not treated, they will still end up giving the infection back to you. Okay, so that's why when you find out that you've got PID, you have to tell your partner, so that as you are treating yourself, they are also treating themselves as well. All right. So I believe that I've given us a little bit of an insight about what PID is all about. Thank you so much, and please do not forget to like and share, and also follow this page as well. Thank you so much, and I will see you in my next video. Bye.